Dr. Melnick, many people, most of us at one point or another have bleeding gums. Sometimes we don't pay attention, goes on for long, sometimes it's a short type of thing. Tell us about bleeding gums. Does it matter? Does it matter whether gums are bleed? Is it a normal thing, just something which happens? Or is it not a normal thing and a sign of something much bigger behind?
Well, typically if someone has bleeding gums, it's usually one of the first indications of gum disease or periodontal disease. You know, years ago, if someone came in and they had bleeding gums, if it was just a little bit and they hadn't had their teeth cleaned in a long time, we would have, clean their teeth and, kind of be done with them. However, medical research has shown that there is a mouth-body connection. And there's a number of medical conditions that we're now finding that are affected systemically from oral causes. For example, we've known for a while that people with gum disease, bleeding gums and the like, are twice as likely to have heart disease, increased risk of heart attack, stroke, and cardiovascular disease. But there's also a slew of other diseases up to and including some forms of cancer, like stomach and colon cancer, that are now being linked to gum disease. And the question was, what's the link? The link seems to be oral bacteria. When bacteria builds up above and beyond normal levels in the mouth, it can get into the blood system, and it can either attach to the walls of the blood vessels, causing clotting, and clots can get dislodged into the heart, causing a heart attack, or the brain, causing a stroke, or in the lungs, an embolism, or it can increase things like one's blood pressure, or again, it can get spread through the body, causing inflammatory reactions, causing a whole slew of other problems. So nowadays, when dentists look and examine a patient and they have bleeding gums, we're not so quick to dismiss them after a simple cleaning. We want to make sure that we get that bleeding under control. So there's a whole variety of treatments from, deep cleanings to mouth rinses to the use of lasers today that we use to combat bleeding gums.
Right. So, what you're saying, basically, you say the bacteria can get into the blood vessels. As we probably, most of us know somehow, the mouth, I consider it, literally if not the gateway to the blood vessels. I mean, just go and take some salt or some other type of pill, put it under the tongue, and it gives you a jolt because it goes in the blood right away. Now imagine that those blood vessels are all laid open with an infection, which is what an infection is, an infection is an open wound. Am I wrong here?
No, that's right.
So all of a sudden you have these infections there, and you're basically now pre-proposing your body to be poisoned minute by minute all the time. And all the health soldiers, whoever they are, the antioxidants, the whatever, need to go there to fight this infection. How many are more left over for the next flu and all those things? It's like, we're fighting 2 wars in the United States now. Do we want to have a third one in Korea or God only knows where? Where are the soldiers coming from? It's a little bit the same way. Let me ask you, is it true that I've heard that gum disease also has been responsible for, in pregnant women, for many premature births and thus underweight babies? True?
That is true. That's what recent research shows. There are also ties between people with gum disease and diabetes.
Yes, I can see that. And in Japan, there was a university who, and a professor there who figured out that, it's just, I guess, statistical research, that people who have gum disease, and if they happen to be infected with the HIV virus, which thanks God is not everybody, they get the AIDS much easier. It turned HIV virus in itself, like we have this one basketball player who has it for a while, but that doesn't mean he has AIDS, and which is a good thing. Why? His immune system is probably pretty good. He's a sports guy. He eats right. He has a good immune system. But if you don't have a good immune system, things turn bad right away. And so if that's true, and if gum disease can make something so bad happening, like premature babies and all those kind of things, again, what about the next flu season, which surely is going to come? What about the fatigue a person might experience, type of thing? Right or wrong?
Well, my attitude on healthcare is that if we have a role in controlling some of the factors that can lead to disease, it's incumbent upon us to take advantage of doing the right thing. You know, there are things that are going to happen that we don't have control over, genetic factors and the like. Right. But something as simple as keeping your mouth clean and coming in frequently enough to have the areas that you're missing removed by a dental hygienist or a dentist doesn't seem that difficult to, assure yourself of optimum health.
Right. And it seems to be a definite trend. Teeth can cause headaches and shoulder pains and other little things. Teeth can cause wrinkles and an elder-looking face. Teeth can definitely cause other illnesses, which then, it must be much more difficult to repair a kidney or liver which was poisoned by this yellow, reddish pus in your mouth. Everybody would go to a doctor right away if he has something on the finger or on the whole hand, which is infected and doesn't heal. He would run to a doctor very fast. People go for an ingrown toenail right away, and an ingrown toenail is nothing but an infection the same way that it happens in the mouth. And so dentistry or keeping your oral health healthy goes far above of looking good and chewing good, which in itself, is important. Well, Dr. Melnick, informative as always. Thank you very much.
Thank you, Helmut.